Hi everyone, I am Dr. Sofica Bistriceanu. I am a family physician, PhD. I would like to thank you for the opportunity to share here some data from my clinical practice referring to the brain hemorrhage etiology. The title of my presentation is Determinants of Brain Hemorrhage in Vulnerable People. Content of my presentation: brain hemorrhage, general data, definition, etiology, classification, diagnosis, mortality, epidemiology. Then, evidence from clinical practice referring to the determinants of brain hemorrhage, data from the author's clinical practice from 1985 to 2023, including case reports from number 1 to number 7. Case report number 1 highlights the effects of excessive physical exercise, sunlight exposure, alcohol use, communication comfort versus improper communication effects on old individual. Case report number 2 highlights the effects of excessive physical exercise in winter for seniors. Case reports number 3 highlights the effects of unskilled delivery of bad news on vulnerable people. Case report number 4 highlights the effects of improper communication in a family between mother and daughter. Case report number 5 highlights the effects of improper communication in a family between partners. Case report number 6 highlights the effects of improper communication between business partners. Case report number 7 highlights the connection between alcohol use, falls, brain hemorrhage, and epilepsy seizure in vulnerable people. Conclusion and references. Brain hemorrhage, general data. Brain hemorrhage definition is a bleeding in or around the brain. It is often called a hemorrhagic stroke. A brain bleed needs hospital treatment. I'll share only essential data because time is limited. Etiology: cardiovascular condition, chronic kidney disease, head injuries, falls, improper communication. I will share this idea in details here. Drugs, tumor, and excessive physical activities. Risk factor for stroke and aneurysm, insufficient physical activity, which increase body mass index, type 2 diabetes, excessive alcohol intake, pregnancy, contraceptive use, hormone replacement therapy, liver disease, menopausal genetics, and so on. Classification, looking at the location, epidural, subdural, subarachnoidal, and intraparenchymal hemorrhage. Looking at the vessel, bleeding, arteries, vein, capillary bleeding. Looking at the severity, major brain hemorrhage, medium, minor brain hemorrhage. Looking at the clinical manifestation, transient or silent stroke, vocal stroke, acute or delayed, after more than 6 hours to several weeks post-injury. Diagnosis. Clinical diagnosis: signs and symptoms, usually severe headache, neck pain, visual changes, weakness, nausea, vomiting, confusion, seizure, collapsing, sleepiness, disorientation, numbness, paralysis of the face, arm, or leg, particularly on the side of the body, difficulty swallowing, dysphagia, loss of balance or coordination, vertigo, difficulty understanding. Unequal pupils, warning sign, face dropping. It's time to call 911. Sometimes no warning signs. Someone falls. The symptoms may appear more slowly, possibly days or weeks after the head injury. Sensitivity to light, difficulty moving or walking, shaking, seizure for 7 to 25% of patients diagnosed with this medical condition. 3 signs of serious brain dysfunction: comas, absence of density reflexes, apnea. For diagnosis, we can use computerized tomography, CT scan, magnetic resonance imaging, lumbar puncture, transcranial ultrasound. Differential diagnosis with epilepsy, coma, ingestion of toxic substances, drugs, overdoses, advanced hypoxemia, spine injury. Mortality, what is important, 45% died within a month. 26% survivors rates after 5 years. Usually stroke survivors present excessive daytime sleepiness. Epidemiology, cerebral bleeding affect people aged more 85. Brain hemorrhage represents 20% of all cases of cerebrovascular disease in the United States. And 5.3 million people have a disability due to a previous brain injury. Stroke is a fifth death cause in United States. Evidence from clinical practice referring to the determinants of brain hemorrhage. Case report number 1, determinants of brain hemorrhage in vulnerable individual. Data presented at the International Conference in Nursing Care Patient Safety in May 2023, Dubai. Essential data. Findings. In September 2000, the patient aged 69 after excessive physical exercise in his garden, sunlight exposure, used alcoholic drink in high spirit with his son. The next day, he presented headache, anisophoria, nausea, vomiting, and blood pressure of 172 millimeters systolic value, blood pressure with 105 millimeter mercury, diastolic value of blood pressure. Patient health history, longitudinal data until 2000. He was registered with hypertension from 1985. So after 15 years in evolution of hypertension, in this context, the patient was registered with brain hemorrhage. Patient family health history, father hypertension, mother hypertension, intestinal infarction. Action not taken. The patient was transported to the hospital, diagnosed to be a brain hemorrhage. Communication skills was considered for moral distress restoration of his dear ones. Results, after 2 months, the patient was all recuperated. Conclusion, prolonged physical exercise, sunlight exposure, alcoholic drink use lead to brain hemorrhage in vulnerable people. Patient longitudinal data. One day in February 2020, so after 2 decades, the patient participated in a forceful discussion with his children. The next day, he received terrible news from another family member. 2 hours later, he presented headache, vomiting, and anisophoria reappeared. So clinical sign of brain hemorrhage. The patient family called the ambulance in the hospital. The patient disease management was conducted by an interdisciplinary team. Results, the patient died 5 days later. Conclusion, forceful discussion and bad news altered blood vessel function leading to brain hemorrhage in vulnerable individual. So for this patient, we have 2 facets of communication, comfort of communication, but the patient was registered with brain hemorrhage because he worked excessively in his garden. He was exposed more time to sunlight energy, and used alcohol drink. After 2 decades, only experienced the same patient experienced only forceful, inappropriate communication with his family, and after that he was registered with brain hemorrhage. So two facets of communication which can lead to brain hemorrhage in various contexts. What is important here, talks power influence the blood vessel organ. Vehement debates imply verbal, non-verbal, improper communication style, which affect mental functioning through their energy and meaning. More details relating to this case you will find as staff of this conference, of this meeting. Case report number 2, excessive physical activities lead to brain hemorrhage in older individuals. Data presented in December 7 at Nursing 2023 virtual meeting. Essential data, one day in the winter of 2023, a patient aged 81 worked excessively in his garden from morning to evening, with only 40-minute break for lunch. Later in the evening, he complained general discomfort and refused dinner with his family. The following day in the morning, he experienced vertigo and difficulty standing up. So some clinical sign of brain hemorrhage. Patient family medical history, hypertension. The patient medical history, only prostatadenoma diagnosed in 2016. Action or taken. The patient family called the ambulance and the medical team monitored the patient. Results after 25 minutes, the patient died. Soon, clinical sign of brain hemorrhage appeared on the patient's skin, on the eyelids. Conclusion for senior, excessive physical exercise in winter disturb their equilibrium, leading to disastrous consequences. Informative programs are required. Implication discussion, too much physical exercise, and in addition, cold air, wind, and the heavy clothing, because it was the winter, increase heart activity. So people must ponder their activities according to their tolerance level. Case report number 3. Unskilled delivery of bad news leads to brain hemorrhage in vulnerable people. This presentation, I presented this case study at the International Nursing Science Conference, August 2023, London, hybrid conference. Essential data, findings. One day in the evening of autumn 2020, the patient aged 71 was informed by a panicked family member about a car accident of her son. He immediately presented headache, difficulty speaking, or clinical sign of brain hemorrhage. The family called the ambulance. The patient was treated in the hospital. After 10 days was discharged. Her family doctor continued to monitor clinical outcomes. The physician manages the situation using medicine, communication skills, behavior change information. She informs the family members about communication skills significance for disease evolution. Educational programs relating to this topic or initiated in the family and the community. Conclusion, unskilled delivery of bad news to a person at risk alter blood vessel functioning and can lead to disaster, as I presented. Case report number 4. Inappropriate communication leads to brain hemorrhage vulnerable people. Data presented at Nursing Research Conference, Singapore, 2022 March. Essential data, findings, woman aged 57 experienced from time to time offensive attitude discussion with her partner. Each time after such interaction, she noticed an increase in blood pressure and headache. One day in mid-2021, the patient experienced forceful discussion with her partner. The headache was short and noticed. The next day in the morning, she observed in the upper lower left right eyelid, nasal base, skin problems, red purple color edema. Headache was maintaining. Action are taken in patient health history. What is important? Hypertension from 2017, overweight from 2017. Patient action are taken. The patient followed her family physician, a minor brain hemorrhage registered by the doctor. She recommended her treatment to the hospital. The patient did not agree with that. The family physician dealt with the situation using drugs, behavior change information. The follow-up doctor's visits are scheduled for the first 12 hours, 4 hours each, done at 6 to 8 to 12 hours. The doctor advises the patient family members to be more attentive interaction with the patient, kind words, generosity, peaceful dealings or regard, better rest, stable energy, light therapy improves the disease evolution. So this kind of interaction between partners can generate brain hemorrhage in vulnerable people. Results after 3 days, the eyelids, nasal base, skin lesion were well recuperated and headache disappeared. Conclusion, forceful discussion alters the functionality blood vessel and determine hemorrhage in fragile area. Repetitive exposure to such events can lead to disaster. Case report number 5. Minor brain hemorrhage determined by improper communication between family members, between mother and daughter. Excessive debates can cause brain hemorrhage in vulnerable individuals. I presented this data at the 6th International Conference Palliative Care Medicine Hospice Nursing meeting, November 2023, London Hybrid Conference. Essential data. One day in autumn of 2023, a patient aged 63 had a conflicting conversation by phone with her daughter, aged 41. Immediately she experienced an intense headache, which persisted for the following days, accompanied by occasional vertigo. After a week, she noticed a change in the color of her left eyelid, which turned red purple. Although the intensity of headache decreases, the vertigo continued to persist intermittently. Action were taken. The patient monitors the blood pressure, which remained normal, and medicine were used to alleviate the pain. Once she observes the modified skin color of her left eyelid, she called her family doctor. The physician manages the situation using drugs, communication skills, behavior change information, interdisciplinary collaboration. She informs the patient about the harmful effects of improper communication, blood vessel functioning, advising her to avoid such interaction. Clinical outcomes improved the next few days. Conclusion, inappropriate communication determined bleeding in fragile area. Educational programs are required. In this picture, I put the idea of communication comfort. So, two facets of communication. Inappropriate communication can lead to brain hemorrhage, and communication comfort increase the individual well-being. Case report number 6, inappropriate communication leads to brain hemorrhage in vulnerable people. Abstract that I presented last year in webinar of Allied Academies, 25th Anniversary Scientific Services. E-poster, this was the e-poster, and I received the Best Poster Award. Essential data. A patient aged 51 experienced improper communication with some community members. From time to time, at the beginning of January 2020, 2022. She presented a headache after a forceful face-to-face discussion with her business partners. The next day in the morning, she observed in the upper lower right eyelid skin problems. Red purple color edema, headache was maintaining. Patient health history, but it's important, hypertension from 2018. Patient family health history, mother, brother, type 2 diabetes, father, hypertension. Action or taken. The patient followed her family physicians. The doctor registered minor brain hemorrhage and she recommended her treatment in the hospital. The patient disagreed with that. She did not consider the better as benefit for the disease evolution as the physician recommended. And the patient decided to continue to work daily taking all the drugs. The doctor manages the situation using IT devices, medicine communication skills, behavior change information. Conclusion. After 70 days, so not 3 days as in the previous case, the patient's skin lesion was reduced in upper lower right eyelid. Why? Because the patient did not respect the bed rest. She continued to work daily, taking only the drugs. Best results means to pay attention to the value of other components of disease management. Bed rest, emotional support, communication skills, stable, comfortable environment, air, energy. Lack of some of them prolongs the disease evolution, maintaining, altering, or in the damaged area. Job concern is not a top priority in such situation. The patient agreement is the medical team recommendations. Both are for transferring the data of interest, not to force, not to impose, only quite flooding of information. I put in this picture this idea. Forceful discussion between business partners can lead to brain hemorrhage in a vulnerable individual. Case report number 7. Brain hemorrhage connected with epileptic seizure. Data presented at the Global Expert Meet of Neurology, Neuroscience, and Brain Disorders, Paris, France, April 2023. Findings. In 2010, an alcoholic patient aged 72 fell, resulting in a minor brain hemorrhage and presented status epileptics. Patient medical history, hypertension from 1997, type 2 diabetes from 2008. Patient family medical history, mother, hypertension, brother, type 2 diabetes. Action or taken. She was treated with diazepam and other drugs for her disease. Results after 3 weeks, the clinical outcomes were improved. No relapse was reported. Conclusion. Heat traumatic injury by falls leads to brain hemorrhage and initiate epileptic seizure in a vulnerable patient. Discussion implication. Alcohol use in a vulnerable patient facilitate patient falling, possibly initiating bleeding impacted area. Brain hemorrhage may initiate epilepsy seizure. People must be informed about alcohol consumption effects on their health. Conclusion. Factors leading to a brain hemorrhage in a vulnerable individual: arterial hypertension, dyslipidemia, determinant atheroma plaque, type 2 diabetes. Type 2 diabetes is accompanied by arterial hypertension, dyslipidemia. Improper, what is new? Improper verbal and non-verbal communication, wrong delivery of bad news may lead to brain hemorrhage. Heat injury, traumatic, false, physical aggression, and aggressive words towards energy act in this direction, brain hemorrhage. Possible brain hemorrhage. Excessive vascular inflammation, dilatation, excessive alcohol consumption, excessive physical exercise, excessive exposure to sunlight in warm season, advanced hypoxemia, severe infection, abnormal immunologic reaction, chronic kidney disease, drugs, tumors. Awareness of all factors mentioned above is necessary for preventing treating a brain hemorrhage. Professionalism is required. People must be informed about the negative effects on their health of inappropriate verbal, non-verbal communication skills, bad habits, unhealthy environment. Educational programs using a hybrid model are needed. At the end of this presentation, the audience will be able to recognize the power of communication skills to influence the well-being of individuals based on real-life example, how improper communication can initiate, maintain, accelerate the evolution of arterial hypertension leading in connection with other medical conditions to the brain hemorrhage, identify determinants of brain hemorrhage in a vulnerable patient, initiate an educational program in the community for preventing and treating brain hemorrhage, evaluate the effectiveness of educational programs. The cheapest informative message for people's health, people like, please, and will be rewarded. Thank you for attention. And here, list of references. Thank you.